Hello, my name's Ian McCarthy. I'm one of the doctors here at the emergency department in Derriford Hospital. We're going to show you a short video about what happens to you when you check into the emergency department. We've made some changes to the way we're working recently in order that whether you arrive by ambulance, you self-present or you're referred by NHS 111, we can get you to see the most appropriate person in the most appropriate place. As you arrive into the emergency department, we would ask you to use alcohol gel and ensure that you're wearing a mask. You may be asked why you are attending the department today. If you self-present to the emergency department, you'll have to book into reception and provide some basic information about why you're here. You'll be given some paperwork and asked to take a seat. After taking a seat, you'll be called into a cubicle where a senior practitioner will ask you some questions while a nurse takes some routine observations. After this, you may then be brought through to our testing area for some blood tests and other initial investigations. If you need x-rays or scans, we will organise these now as well. You may also be given any medication or painkillers that you may need. We may, after your initial assessment, discharge you, redirect you to another service or department, or ask you to return to the waiting room to wait for a full assessment by one of our ED practitioners.
When you arrive at the minor injuries unit, you will be greeted by one of our friendly reception team.
I'll start by verifying some of your personal information, your age, your address and your local GP surgery, and follow up with some questions about your visit. Why have you come to us today? When and where did the injury occur? However, if you are clearly unwell, we will ask a nurse practitioner to come and see you straight away.
You'll then be seen by a healthcare assistant who will triage you and assign you with a category based on how urgent your needs are. You will then be asked to take a seat in the waiting area. By coming to see us at the minor injury unit, hopefully your wait time won't be too long. Our average wait time is between 1 and 2 hours. Here at the MIU we are able to take x-rays, but we are also able to see you about other injuries and conditions too. Not everyone that comes to the minor injury unit will need an x-ray. We can see and treat other conditions such as lacerations. We are happy to see burns and stings, bites, head injuries as long as there is no loss of consciousness. We can also see a variety of minor illnesses such as sore throats, eye problems or ear problems. If your problem is older than 2 weeks, please see your GP. So, why come to us at the minor injury unit at the Cumberland Centre? We are centrally located in Plymouth, we have free parking, we are on the local bus routes, and we are open every day of the year, including Christmas Day, from 8:30 in the morning until 9 o'clock at night, and we have a very highly skilled team of staff to see you.
Hello, my name's Ben Jameson. I'm a GP and I'm the clinical lead for the acute assessment unit. We're really pleased to be able to talk about the opening of the new unit. It's absolutely essential at this time in the pandemic that we've got a way to manage patients safely and with compassion without having to admit them to hospital. This means that people can get an answer to their pressing clinical question on the same day without having to be in an area and exposed to potential risks of infection or deconditioning and the inconvenience of being away from home and disrupted lives. The acute assessment unit is an area where we can provide same-day emergency care. We work with a team of dedicated nurses, therapists, specialists such as neurology and the acute frailty service in order to meet the needs of patients.
The new unit that we've just moved into is not quite purpose-built, but it's providing a much nicer area for our staff to care for our patients. It provides greater dignity for our patients because we've got more space. The treatment area has doubled in size, which means that we can take more patients from the emergency department and also from our community referrals from GPs and also from SWAST.
And we want to provide as much care for people as close to home as possible. We support that through the acute GP service and the acute referral hub, which is 01752 437777 option 1. And that way community clinicians, GPs, paramedics, the community crisis response team can speak directly with a doctor who is working on the acute assessment unit, who has access to the resources of the hospital to arrange for the investigations and care that a patient may need. It's been an incredible journey to move into this new unit, and I do want to thank everybody who's made this possible. We didn't lose a single operational day. The nurses and staff on the unit came in at the weekend. The estates team have been incredible with the building work that they provided, and the whole of the urgent care system has recognised the importance of providing a good ambulatory medical care for patients so that they can get the assessment and care that they need.